My name is José González-Costello. I come from Barcelona, from the Hospital Universitario de Bellvitge, and I'm the coordinator of the Advanced Heart Failure Unit at Bellvitge. We do have great medications currently. We have the Fantastic Four, which have decreased morbidity and mortality in our patients. However, our patients are still at risk of sudden cardiac death, especially in the first 3 months after discharge, because obviously we have to up-titrate these medications, and the guidelines tell us that we have to wait for the ICD implantation at least 3 months of optimal medical therapy to check the left ventricular ejection fraction of these patients. So it is very relevant. So in order to assess this long-term treatment, we have to risk stratify these patients for sudden cardiac death risk. And we need to develop newer strategies to do this. Obviously, left ventricular ejection fraction is the main strategy, but we must also introduce other techniques such as cardiac MRI or genetic testing that can help us risk stratify. But this takes time. So during this phase, after discharge of a first episode of acute heart failure, and before we can up-titrate all the medication appropriately, we need to protect our patients. So implanting an ICD directly after or during the hospitalization is not indicated. Prolonged monitoring in the hospital facility is not feasible, and therefore a wearable cardioverter defibrillator is a very good option for these patients to go home and wait for up-titration of medication, reassessment of left ventricular ejection fraction, and also give us time to perform cardiac MRI, genetic testing, in order to fully assess the risk of sudden cardiac death in these patients.